السلام عليكم أعزائي الطلبة. موضوعنا إن شاء الله اليوم اللي هو الجزء الرابع من infectious disease. We will talk about two subjects which is more high-yield important subjects in medicine and infectious disease, which are Leishmaniasis and malaria. First of all, Leishmaniasis, there are three types of Leishmaniasis, which are cutaneous, mucocutaneous, and visceral. Regarding visceral Leishmaniasis, is caused primarily by Leishmania donovani and Leishmania infantum. Leishmania invade and replicate within host macrophages, evading innate and cell-mediated immune responses. Infection generally appears to persist after a clinical cure of the primary infection. Many leishmanial infections are asymptomatic. The ratio of asymptomatic infection to clinical infection varies widely and may depend on a variety of factors. Most patients with subclinical infection harbor viable parasites lifelong and can develop reactivation disease if immune suppression occurs. The most important clinical manifestation of visceral leishmaniasis is syndrome known as Kala Azar, or in Hindi for black fever. The incubation period is usually 2 to 6 months, but can range from few weeks to several years. With insidious or subacute onset, with slow progression of malaise, fever, weight loss, splenomegaly, with or without hepatomegaly over a period of months. Acute febrile illness can occur with rapidly progressive symptoms. Definitive diagnosis requires demonstration of parasite by either histopathology or culture of material obtained by needle aspiration or biopsy from affected organs, usually bone marrow or spleen, and then by smear named Giemsa stain. And there is another ways which are the serological tests, including indirect fluorescent antibody test or IFA and ELISA enzyme-linked immune sorbent assays and agglutination tests for specific diagnosis. Regarding management, we should appreciate the response to treatment by assessment of clinical symptoms, resolution of fever, decrease in spleen size, and weight gain. Serologic tests are not useful tests of cure as they remain positive for months or years after treatment. Malaria should be suspected in the setting of fever, usually more than 37.5, and relevant epidemiologic exposure. The diagnosis of malaria is definitely established in the setting of symptoms consistent with malaria and positive malaria diagnostic tests, which are light microscopy and rapid diagnostic tests.